Medical Mysteries, New York Emergency Room. And look, if you have any sort of interest in medicine, perhaps you're a doctor yourself, perhaps you're a nurse, perhaps you're at medical school, perhaps you're an ambulance driver. Look, if you have any sort of interest in medicine, you're going to really enjoy this game. We're going to go deep and we're going to actually solve, I guess, fix this person's problem because we are doctors and she has just come into a hospital and unfortunately it's my very first day on the job and I've got to somehow find a way to heal this patient. Now, we have a whole bunch of information here. So we've got a booklet here on a whole bunch of drugs. We've got gynecology. Now, this is going to go very in depth. That's why I reckon this is great for anyone who is in medical college, who's studying medicine. Different conditions. Then you can also Google this, go into more detail as well. Brain health, and we've got all different types of tests. So we may need these throughout the episode. Now, what else have we got here? So this is the patient intake interview. So we're going to speak to her at the start. We've got her electronic medical record. We've got her status at the moment, and her status is agitated and anxious. Now, normally I would be filling out all my answers on this little sheet, but you know what? Today, we go good old-fashioned pen and paper. I'm going to write everything down here because that's the way I work. Anyway, let's get into, firstly, starting off with her story card. So we've got that. And basically this gives me the very first thing I can do to this patient, and that is asking her a question. But before we do, let's get some background on our patient, Shaila Patel. So 37-year-old female. She's speaking quickly, extremely agitated and anxious. It started when she was running, chest pain, trouble breathing. I asked, what was the pain like? A tightness and pressure in my chest. Yes, it still hurts. Not as bad though. At first it was a stabbing pain, about a 9 out of 10. But now it feels more crampy. Do I still have shortness of breath? Yeah, I do. Come to think about it, I've been more short of breath than usual during my runs. For how long? About a month now. I've been also having trouble sleeping. So she basically goes on to say, look, I don't understand what's happening. I'm really healthy. I'm a marathon runner. She eats right, looks after herself. Her weight's been creeping up a little bit. But as she talks, her words get faster and faster. You tell her to take a deep breath and that's okay. And she has a moment to collect herself. And yeah, look, a lot more information. She normally has 1 cup of coffee in the morning, occasionally a second in the afternoon, a glass of wine maybe once a week. So definitely not an alco. Cool. Okay, well, that's our background. So Shaila, 37-year-old healthy marathon runner, but came in because she has, what's here? Shortness of breath, chest pain, also nausea. And notice here her heart rate is at 136. Now, I know that's high because it's in red. Everything else fairly normal. If anything, her temperature's a little bit off. Her past medical history, she had rheumatic fever at age 5, anxiety disorder since adolescence, panic attack occasionally over the past 10 years. Her family history, mother and 3 siblings are alive and well. Father died from myocardial infarction, which is a heart attack at age 67. He also had hypertension, which is high blood pressure, and they immigrated from India at age 6. She's allergic to penicillin. Her current medications are supplements. No recent travel. Oh God, there's a lot more here. So short of breath, being able to speak in full sentences, has nausea, no vomiting. Patient appears anxious. Her respiratory, normal shortness of breath or cough. Her heat, head, ears, eyes, nose and throat. No changes in vision or hearing. Neurologic, awake, alert and oriented. No headache, dizziness, loss of sensation, loss of function, numbness, tingling or weakness. So that's good. Cardiovascular, irregular heartbeat. Tachycardic, which is a fast heartbeat. Systolic murmur, abnormal heart and sound heard with mitral regurgitation. And no cyanosis. Again, if you're a medical student, you know all these terms. All these terms are so foreign to me. So I'm going to say out of all that, the systolic murmur, abnormal heart sound heard with mitral regurgitation. That doesn't sound right, does it? Everything else seems normal. Okay, no itching, burning or pain. She's sexually active with a friend with benefits, so well done her. Cool. Well, that is all the background. Now, straight away, what are you thinking? So I want to play with you at home. So as you're playing this, I want you to leave in the comments below at this timestamp, what do you think's actually wrong with her? Now, I guess that's my job to find out. So the first thing we're going to do, we're at 0, 0, 0. So we're going to get 3 actions. And after we do 3 actions, we're going to get an update. We're going to do that up to 4 times. And if we haven't solved her by then, after 8 hours in the hospital, she's probably going to die, which would be bad. We don't want to die. So let's go with the first thing we need to do is ask her a question. And the questions are, what supplements are you taking? How much sleep are you getting? When did you start running? Are you sexually active? And what chemicals are you exposed to at work? Let's go with, I'm interested in the supplements. Let's go with the supplements. So that means let's code supplements. And that gives us code RTG. And this book is going to be how we're going to answer everything. It's going to have all of the answers in here. It's just the way the game works. It's really good. It's a great system. I am loving this game right now. Maybe I should get into medicine after this. If I solve her. If she dies, probably not. RTG. It says take story card number 9. So we've got a whole bunch of story cards over here. So there's 32 of them, and we'll see what comes out. So story card 9. Okay, so Shyla says, I take a few workout supplements my trainer recommended. Today I took them around 8 p.m. I know a lot of people swear by them. I've been more fatigued in the last few days after running, so I started dry scooping. I saw it in a TikTok video. Don't go on TikTok, stay on YouTube. It's pretty cool. Instead of mixing the supplements with water, you take them dry. Makes them work faster. Well, that seems awful advice. Bad TikTok. Take story cards 18, 19, and 20. Okay. 18, 19, and 20. Dry scooping. I've never heard that. Sure, I assume it's a thing. Okay, so what have we got? Let's move this over to the side here. Okay, 18, 19, and 20. Well, they're all a whole bunch of supplements. So she's taking Surge Energy Guarana, she's taking Human Sport Power, she's also taking Thermoburn Fat Burning. So what is the common denominator amongst these? 100. I'm noticing all of them have caffeine. Okay. So there's a high lot of caffeine in there. We also know she takes a coffee, up to 2 coffees a day. Maybe she's got too much caffeine. Maybe? Look, I mean, I don't know if that would cause her heart rate to go that high, but maybe. Okay, anyway, so that's all we have right now. She takes a bucket load of supplements and she dry scoops. Do I want to ask any more questions or should I speak to someone? I think the first thing I should do is probably get some blood work. Now, it makes sense. Whenever anyone comes in, just give them blood work. That fixes stuff. Okay, let's do blood work. And I flip it over here and it tells me blood work. If I do blood work within the first 2 hours, I use this code YTE. Blood work results. Okay, her Chem 7, normal. Good. Her CBC, normal. Good. Her troponin, elevated. Now, what the hell is troponin? Okay, I know it's elevated, so I know it's bad. Okay, now, this is where I need to start doing some research here because I don't know any of this terminology. So, CBC, a complete blood count. Well, that checks out. That looks at things like anemia, infection, leukemia. She's good. Her Chem 7 is good, which is a test that looks at 7 different substances in the blood. They're all good. Chem 7, spot on. But troponin, not mentioned at all in here. I'm going to assume, aha, blood work. Troponin, a type of protein found in heart muscle. Normally it's not found in the blood. Greater amounts of troponin are released in the blood when the heart muscles become damaged. Possible causes of elevated troponin include myocardial infarction. Her dad had that, which is heart attack. Atrial fibrillation, pulmonary embolism, physical exercise burns, drug toxicity, and stroke. Now, it Again, I need you medical experts out there to tell me what is the answer right now. I don't know. Could be the drugs, but her dad had myocardial infarction. Atrial fibrillation, maybe? Okay. Well, I know her ticker. I know her heart's not good. Do I run another test? Yes, let's run a test. I'm sure. Test. Here we go. So what have I got? EKG or an echocardiogram? It wouldn't be an X-ray, it wouldn't be a CT scan. Echocardiogram, an ultrasound scan used to diagnose and monitor certain heart conditions. By checking the structure of the heart and surrounding blood vessels, it can detect damage from a myocardial infarction, heart failure, endocarditis, cardiomyopathy, and other heart conditions. EKG, simple, painless, quick test that records the heart's electrical activity. Do you know what? Echocardiogram. Cardiogram. Whew. Well, sweetheart, we are going to take you in and look, we're going to fix you up with an echocardiogram. I'm sure this will fix you. I have confidence. I have confidence in this. Let's do this. Echocardiogram. And we're within the first 2 hours, so it's code HGD. Let's see, what is the result of that? HGD. HGD, CTGB. Well, that's random. Okay, TGB. TGB. Okay. While sedation isn't necessary for this test, the anaesthetologist recommends administering midazolam for conscious sedation because the patient is so anxious. However, this may interfere with the test results. To proceed with midazolam, see RER. To use a local anaesthetic sprayed in the throat, see XPX, or select another test. Sure. I mean, you recommend midazolam, but I'm not feeling comfortable right now. I'm going to go with the local anaesthetic sprayed in the throat, XPX. Okay, so let's see where we're at now. These are decisions you have to make as a doctor, and like you're actually getting paid money to make these decisions, and people actually like rely on you. That's stressful. I'm stressed just playing this. I can't even find the X's. Where's the X in the alphabet? Okay, well, I've already forgotten what it was. XPX. XPX. The results show that the patient has mild mitral valve regurgitation. Okay, mitral valve regurgitation. Ignore my terrible writing. I apologize for that. It's doctor's writing. Be sure to record local anaesthetic under treatments on your final report. Okay, treatments. We'll do that. Treatments, local anaesthetic. Okay, so we know she has a mitral valve regurgitation, which I can't remember if that's bad. Is that bad? Where did I read that? Mitral valve. There we go. She's got a systolic murmur, abnormal heart sound heard with mitral regurgitation. So I already knew that. Well, that didn't help me at all. Anyway, we've done our first 3 actions, so we now need to do the first update. So the first update here is at 2 o'clock. So this patient has been in our hospital for 2 hours, which isn't bad. I think I've done a fair bit in the first 2 hours. Okay, let's move all these over here. Now the update. Let's have a look. Where is the update? The update is right here. So because we're in the first 2 hours, update is WPS. WPS, take story card 15. I hope she's all right. I mean, have I done a good job so far? Like, I've done an echocardiogram. I've done some blood work. I know she's taking a lot of caffeine. I think I'm doing pretty good as a doctor. Okay, Shyla seems to be even more agitated when she first came in. I'm really not feeling well. I feel like I'm having a panic attack, but much worse. She starts crying, hiding her face in her hands. Why is this happening to me? Suddenly she looks up, her eyes opening wide. I need the bathroom. She gets up and stumbles into the bathroom. Well, look, when we have to go, we have to go. She closes the door and you can hear her continue to cry. When she comes out shortly after, she barks at you. Why aren't you taking care of me? Is there something you aren't telling me? Well, yes, there is something I'm not telling you. I don't actually know what's wrong with you. I'm not a doctor. Okay, but that's fine. We're still pretending we're doctors. Okay, now what am I going to do next to fix her? So obviously, we know that something's wrong with her heart. Let's have a chat. I mean, cardiologist would make sense. Is there anything else I want to do? Do I want to ask her more questions, perhaps? What else was in her blood work? Troponin was elevated. Okay, so that's to do with the heart. This has got to do with the heart. I know she's taking a lot of caffeine. No, it's a long shot. Could she be pregnant? I'm just thinking some of these things could be pregnancy. There is a pregnancy test there. Let's do it just be on the safe side. Before I take this any further, let's find out if she is pregnant. RFG. Just like I feel like it's leading me down the heart problem, but what if there's something else? RFG. Take story card 6. Oh, please don't tell me she's pregnant. Please don't tell me she's pregnant. Friends with benefits. I mean, you got to be careful. Well, there you go. That's not possible. I can't be pregnant. Well, do you know what? That's 100% pregnant. That's a cross right there. Well, that's put a spanner in things. So you're pregnant as well, on top of everything. So now what do I do now? Do I speak to a gynaecologist because she's pregnant? Do I speak to a cardiologist? Maybe we'll go through a gynaecologist first. Okay, so 0240. Let's go speak to a gynaecologist and see what is up with the baby. So gynaecologist GYH. Please tell me that you would have checked for a pregnancy test as well. Like, come on. Are you really qualified to be a doctor like me? I nailed it. GYH. And we have takes card 22. The gynecologist gives Shyla a pelvic exam. I have to be the bearer of bad news, Shyla, but your IUD is hormonal, not copper. It stopped being effective about 7 years ago. Whether you are pregnant or not, it's important to have the IUD removed. Let's schedule an appointment to discuss your options. You were having a bad day. You came in because you were had anxiety and stuff, and now you're pregnant. You got an IUD that's gone bad, and we still don't really know what's wrong with your heart. So let's do one more thing. Oh, do we do an X-ray? No, we don't need to do an X-ray. A pelvic, or did she already do a pelvic exam? I mean, I'm kind of male. I don't know. I think that's a pelvic exam. Okay, I'm going to go speak to the cardiologist because that's the other thing that's wrong with her old ticker. So let's go figure out what is going wrong with her cardiologist. So YUI for the cardiologist. So it pays to keep very good notes in this game. YUI. Takes story card number 3. The cardiologist says her symptoms point to a heart condition. It's unlikely a myocardial infarction given her age and fitness level. Her father had a myocardial infarction but at a later age. I believe she has atrial fibrillation. I wonder what the cause is. However, you have more pressing concern. Your patient is so agitated, I'm afraid she might get a stroke. Well, that's not good. So atrial fibrillation. and possibly going down a stroke. So this is getting worse. And we've got our next update. We've now been in 4 hours. Let's get the next update. So the next update is going to be FWW. Again, hopefully you're enjoying this. I don't know how this is going to go, if this is something you're going to enjoy or not. But if you enjoy it, please leave a comment, because it's nice to know people actually watch my stuff. Take story card number 10. And when you look in on Shyla, you see her condition has gone from bad to worse. She's pacing around her room like a caged animal and won't sit down. She sees you and rushes to you. As she does, she kicks over her backpack. Several items spill out onto the floor, including some supplements. Shyla immediately starts to hug herself and cry. Do you mind if I look at these? You ask. She nods. Says, if you haven't already, take story cards 18, 19, 20. Already know your supplements. Not helpful. Cool. So she's getting worse. So what do I do now? Well, we need to fix her. Okay, what can I do to fix her again? I've done cardiologist stuff. Does she need a psychiatrist? Does she need a CT scan? Is her brain not working? I'm running out of ideas. I know she's getting worse. So what does that mean? What's a cardioversion? What's a cardioversion? Tests. What's a cardioversion? Okay, that's not on here. Can someone tell me what a cardioversion is? Procedures. Cardioversion, a medical procedure that uses quick, low-energy shocks to the heart to restore regular heart rhythm. It's used as a treatment for certain types of arrhythmias, serious conditions, blah, blah, blah. Blood thinning. Would that help a heart? I hope I'm not cutting you up. Let's go in. What's this ACLS assessment? ACLS assessment. Advanced Cardiovascular Life Support, a set of clinical guidelines for the urgent emergent treatment of life-threatening cardiovascular conditions. I don't think it's that. I feel like we need to cut her open, surely. Let's do a cardioversion. Hopefully this isn't the bit that I kill her in, because that would be bad. Bad. KUY. Let's go. What have I done? What have I done? Doctor, what have you done? KUY. The nurse says, this may be extreme for this situation. There are less drastic ways to control heart rate or rhythm. Try something else. This action is complete. Okay, so definitely not a cardioversion for people playing out there. Maybe drugs. Let's give her some drugs. Drugs will fix everything. Drugs to regulate the heart rhythm. Amiodarone. That's the first one I read. Let's do that. Let's give her some Amiodarone. 0440. And I mean, look, a good doctor would read all these drugs, but I just went to the first one I read, and that seemed good to me. ZXS. Here we go. ZXS. Amiodarone does an effective job of managing the symptoms of a patient's atrial fibrillation while reducing the chance of a stroke. I feel pretty happy right now. So basically, take status card number 3, which means she's now stable and calm. Well, that's good. And also take number 30. Status calm. Shyla has calmed down. Her heart rate and breathing have slowed significantly. She looks much better. You successfully dealt with her symptoms, and she's out of immediate danger. Take story card 32. This is a good story. You're gonna feel very warm inside after this story. Congratulations, Shyla has survived the night. If you've treated her symptoms but don't yet know the underlying cause, okay, so this is where I've got to the final bit where I've got to answer some questions. So I've got the option to basically keep working on her, but I don't want to do that. I think we've solved it. She's pregnant and she had a heart thing and she just needs to take Amiodarone. Okay, so what was the cause of Shyla's symptoms? Well, she had an atrial fibrillation. and she was taking too much caffeine. What treatments did she require? Amiodarone. And what recommendation do you have for it? Well, probably have the baby. That would be first suggestion. Lay off the dry scooping because that's bad. Maybe stop running marathons for a while because that's going to be hard. And look after your heart. Your dad died at 67. Come on, Charlotte. Just be smarter with your life choices. So now we get to enjoy the actual ending. So I bet you're all dying to know what was the answer. Well, look, just before her run tonight at about 8 p.m, Charlotte dry scooped a supplement that had multiple sources of caffeine. Basically goes on to say, lots of caffeine, toxic effects, cool, bad. To prevent her from having a stroke, you calmed Charlotte down. A psychiatrist could have helped her learn to breathe through her stress. Well, didn't think about that. But you would have had to wait until after 4 a.m. when her body had already processed most of the caffeine that was making her so anxious. So much you learn. Beta blockers would have stabilized her as well. Blood thinners would have done a trick as well by addressing Shyla's atrial fibrillation triggered by caffeine and stress. Well, I didn't do any of those. But you'd want to run a pregnancy test first since these drugs can be dangerous. Well, good, I did do that. Turns out Shyla is pregnant. She had an IUD inserted 8 years ago, but mistaken which type it was. She thought it was the 10-year copper IUD, but really it was a 7-year hormonal IUD. Explains Shyla's surprise at her pregnancy. Given that removing an IUD has a 20% chance of causing a miscarriage and leaving it in has a 55% chance of causing a miscarriage, you should advise Shyla to remove the IUD. I think I did. I'm sure I told her to do that. Finally, although stress and high levels of caffeine likely triggered Shyla's chest pain and atrial fibrillation, her mitral valve regurgitation was an underlying culprit. The MVR could be temporary if it is related to a pregnancy. However, it could cause longer-term issues. If it is related to rheumatic fever Shyla had when she was 6, well, I completely forgot about that. Because you can't rule out rheumatic fever, you should recommend Shyla see a cardiologist after a pregnancy just to make sure. Of course, you should also advise Shyla to stop using her supplements immediately and to reduce her work hours. Strongly recommend she sees a psychiatrist and turn over for your score. What did I get? 50 points if you successfully dealt with Shyla's symptoms and helped her make it through the night. Tick. If you correctly identified caffeine from the supplements. Tick. 15 points if you uncovered that Shyla was pregnant. Tick. 5 points if you recommend Shyla gets her IUD removed. I think I did. 5 bonus points if you realise that although Shyla's chest pain, atrial fibrillation and mitral valve regurgitation were likely caused by caffeine, the mitral valve regurgitation could have been a long-term complication caused by rheumatic fever she has as a child. Definitely did not get those 5 bonus points. Minus 10 points if she has a stroke. Didn't know that was going to happen. There you go. Minus 5 points if you gave Shyla either Midazolam, Amiodarone, or blood thinners, as these drugs should not be given. Well, wow, that old chestnut, the old Amiodarone. That's exactly what I gave her, and whoopsie. And finally, minus 5 points for each overtime action you took after 8 a.m. Well, I didn't take any overtime action, and there we go. Solved Shyla Patel. Now, that was patient number 1. We've got in here a tutorial. We've got patient 2, 3, and 4, and who knows what exciting things we have in here. Adrian, he's old. Gabriella, who knows what she's up to, and Pete. There you go. If you like this medical mystery series, get on board this. This is something I'm super pumped for, and I'm so glad I got a chance to review this, and hopefully you enjoyed this run through. Look, I'm Hogs. This is the Bangers Project. If you like what I do, don't forget to support me. Love a comment, love a thumbs up, or even a cheeky little subscription. Anyway, till next time, laters.